I drank too much. I drank too much last night, bro. I'll be honest
Uh-oh.
with you. I just drank a lot.
All right, we're live. Okay, so I sent you a list of things, and I worded it as things I'm not convinced of yet. It doesn't mean I'm thoroughly convinced of the opposite. It just means that I have yet to be convinced. So, anyways, I don't know what approach you might want to take this, but I was thinking we could go maybe one at a time, and you could try to maybe convince me of your take on them. I'm assuming from what I've seen that you disagree with me on everything on the list, but maybe not everything.
Let me actually pull up again what your list said.
Okay.
I'm gonna see if I can just stream it so other people can see what I'm talking about. Hang
Okay,
tight.
sounds good.
When did you send me this email? It's like so long ago. Let me look here. There's like a giant email chain.
Yeah,
What did you
it
send
was
it to
like
me?
4 days ago, maybe 5
It was 4 days
days.
ago. Okay, I'm looking. Let's see. So it would have been 4 days ago. Would have been like around March 30th, 31st. I'm looking. Um, I'm trying to see where this full.
Yeah, it's my second message to you.
Yeah, I think there's two email
It's
chains.
it's the one
Oh,
that starts with the I can do it tomorrow, Wednesday, 6:30.
let me see here. Ah, found it.
Okay.
Okay, so I can do it tomorrow, Wednesday, 6:30. Okay. All right. Let me share this so other people
Okay.
can see it. Yep, that's what I want to share. Okay. It says language. I have not been convinced that there is a good reason to not have quote unquote sex and gender be synonymous. Okay. Um, well, let me ask you this. Like, do you feel like a man?
No.
You don't feel like a man?
I can only answer that so quickly because I've thought about and discussed these topics for a couple years now. And yeah,
Mm-hmm.
I don't know how I would describe what it feels like to be a man. If I woke up in like a Freaky Friday situation where I was a woman tomorrow and I had my own thoughts, but everything else about maybe my brain became a female or something, it's possible I could tell you the difference maybe, but I just can't think of anything that feels, I don't feel like anything. I just feel like a person.
Okay. Um,
And I want to also point out,
so I mean,
I'm
I just couldn't help but notice
yeah,
that you have a beard. Like, why are you?
yes.
Why do you have a beard?
Partially because I started going bald at a young age and had to shave this off, and so this is a good thing to have. I think it looks nice.
Okay. I mean, it's a pretty like manly thing to do to have a beard.
Yeah, that seems like I, yeah, I'd say that seems like the case. If a woman had a beard, I could imagine
Yeah.
somebody saying that was a manly thing for her to do. Yeah.
Okay. I mean, like, I assume that when you were growing up, you likely did not require a mastectomy when you were going through puberty, as in
Correct.
chest removal.
Correct. Yes, correct.
Yeah. Um, so it's fair to say that you did not have a moment in life where you started growing breasts at any point.
No. No.
Could it be possible that you could have something like that?
Yeah.
Would that kind of interfere with like your internal sense? Like if you started growing boobs at
Mhm.
say 12 or 13 years old, would that interfere with how you see yourself internally?
How I see myself internally, I wouldn't say that. I would say that based on looking around in the world, that I would feel discomfort. Sure, yeah,
So like
like
you would have like a an incongruency between your identity and your sex.
I don't know if I would say that. Well, I don't use the word identity personally often, so I guess I wouldn't word it like that. Um, but yeah, any random amount of things could happen. Like I could start growing a penis on my head or whatever,
I
and
suppose so.
I would feel like okay, in this society it's no good. But if I lived in a world where everybody was human except all the humans had penises on their head, or whatever it was, then I would feel weird if I didn't have one. But yeah, so I don't know I'm just pointing out just to be as clear as possible. It's not like an internalized thing, other than the element of thinking about it that, I don't need to conform to everybody that seems to be what I view as like my sex or whatever. I just, like, I wouldn't care if this shirt I was wearing was thought of as like an unattractive shirt for men or something. I'd still wear it, I think.
So, like, if you started growing boobs, you would not want to get a mastectomy. You would be perfectly okay with a voluptuous pair of breasts.
No, I probably would. Yeah, no, I
Okay,
thought
you
about
would
that.
you would care about that. Your internal sense of what you are would be different than what your body is doing.
No. Maybe it is,
Then
and
what is
I'm just
that?
not wording it right. Because I don't feel like a man. I don't know what it feels like to feel like a man. But because I happen to be one, if the rest of society, like, if something, I'm trying to think of something in the world that society looks down on.
Do people often mistake you for being a woman?
No.
Would that bother you?
Would that bother me? No.
Yeah, they were like
It'd make
all
me
the
think it was a
time,
little weird. I would even probably correct somebody, but
yeah.
no.
So like your internal, okay, so the way people perceive you, right, would be different from your sex.
The way people would perceive me would be different. If they perceive me as different from my sex, then
Yeah.
they'd be perceiving me as different from my sex. Yeah.
Okay, so this incongruency that I'm kind of playing around with, this is the
Yeah.
difference of sex and gender.
Gotcha.
And
Okay.
this can be also understood at an endocrinological level. This can also be understood at a neurobiological level as well.
Gotcha. Well, here, can we pause this for a sec, and I can explain something, and then we'll hop back
Okay.
to where you left off. And part of this just has to, like, words evolve. I'm aware of that. Words will constantly change. Like the word fantastic used to have this meaning of just strange and wild. So like in the movie The Wolfman in the 1940s, they would say fantastic, where now it's only used for teachers to tell little kids how well they did. So yeah, words evolve. And I'm all about words evolving. But let's imagine that this idea of what we consider gender identity, gender expression, let's imagine that to this day that didn't exist. And then somebody today decided to, they wanted that to exist. And so gender and sex meant the same thing. And somebody's thinking like, okay, I feel this way. I'm the first person to do this thing. I could name it myself now, or I can take this word gender, and instead of that being synonymous with sex, I'll have gender now mean this thing, and maybe some other people will catch on and do this thing. And let's say instead of gender becoming this thing different from sex, and you can correct me in a second and point out from the beginning it was different, but let's say instead of that, they created a new word, and I wrote this down. So they created the word blop. Blop is just going to mean what maybe you currently think of gender. And then for anybody that feels masculine or would think of themselves like a man or a male, but they're born female, they would say zim. It doesn't matter what you're born. You would just say zim if you're leaning towards the masculine, and zam if you're leaning towards the feminine. Okay?
Yeah.
So if you were to explain to me what you think of gender right now today, that's what I'm thinking that this person is going to be doing for creating these words. So blop is the word for gender, and then zim and zam. If that happened and somebody created that today, and then you were to say to me, is this person a zim? It doesn't matter what they're born as. If the definition of blop is somebody's gender identity, how they personally identify themselves, I wouldn't be doing any mental math or anything. I would just go, yeah, from my understanding, that's zim. At the same time, it would be a thing I have no interest in. I would never discuss it on my own outside of, conversations like this. in the same way that, there's a bazillion sexual identities, like or sexual orientations. There's like cupiosexual and fictosexual and all these different things. And I'm glad people have those. I don't have any thoughts negative about those. I don't want those people to not exist, but it's just like, it's something I have no interest in, so I never talk about it. Same thing here, where if this thing exists and somebody said, what was this? I would accept any of what they're saying for their thing. I just wouldn't have any interest in it. And anyways, I guess I'm just trying to point out that I've never been convinced that this word blop should exist, or that it should exist in any way I personally would care about. And so same with gender. I've never heard anything that makes me have any interest in the word being changed to not mean sex anymore. And I kind of just wish that gender would keep being the same, synonymous with sex. Because I've filled out so many forms before where it'll say gender and then male and female. Anyways, does that help with anything? The fact that like I don't care.
I think like what you're doing is like you're showing like a colloquial understanding, whereas like I'm operating on a more academic understanding.
Okay.
Not saying that like what you're saying is like stupid or whatever. It's not. It's just what you would be intuitive. But I want to point out a paper to you, and I'm going to present you something.
Okay. Yeah.
Share screen. How do I share this stupid thing? Give me a second. Is it going to let me choose what I share? All right, here we go. Do you see what I am sharing?
Yeah. Let's see.
All right. So I'll read this out for you. So you can understand where I'm coming at with this. The sexual differentiation of the human brain in relation to the gender identity and sexual orientation. It is believed that during the intrauterine period of the fetal brain develops the male direction through a direct action of testosterone on developing nerve cells, or in the female direction through the absence of this hormone surge. According to this concept, our gender identity, as in the conviction of belonging to the male or female gender, and sexual orientation should be programmed into our brain structures when we are still in the womb. However, since sexual differentiation of the genitals takes place in the first 2 months of pregnancy, and sexual differentiation of the brain starts in the second half of pregnancy, these two processes can be influenced independently, which may result in transsexuality. This also means that in the event of ambiguous sex at birth, the degree of masculinization of the genitals may not reflect the degree of masculinization of the brain. There is no proof that social environment after birth has an effect on gender identity or sexual orientation. Data on genetic and hormone independent influence on gender identity are presently divergent and do not provide convincing information about the underlying etiology. To what extent fetal programming may determine sexual orientation is also a matter of discussion. A number of studies show patterns of sex atypical cerebral dimorphism in homosexual subjects. Although the crucial question, namely how complex functions as sexual orientation and identity are processed in the brain, remains unanswered, emerging data point a key role of specific neuronal circuits involving the hypothalamus. So
Gotcha.
What this is reading out is that there's two distinct processes that is happening as an embryo. There is the internal way that the brain develops, and then there is the gonadal development. And these are two distinct processes. They usually tend to go in a specific way, right? Male for male, female for female. But that is not always the case because there are two distinct developmental processes, and genetics does weird stuff sometimes. This is an example of that. This is why there is a necessity of separating gender from sex. And this is not operating from a sociological aspect. This is entirely an embryological aspect.
Yeah, okay. I get this. So I've heard a couple things on this. I want to read that full paper. If you could email that to me, that'd be great.
Sure.
I've heard some people talk about these studies that have been done, and that sometimes when it's claimed that it's like a trans brain, that something like 99% of the people end up being gay and not continuing to identify as trans or something like that. I don't know if when those people talk about that, they're referring to this study, but I do want to do a deep dive into that. Although I don't even see exactly why that would matter. If somebody is born male and their brain seems similar to the average female, I don't know if it matters if they end up being gay or not. The information still exists. So it could just mean that maybe a good amount of gay people want to transition. I don't know. But
it has nothing to do with gay, not gay. What it is saying, right, is that your internal sense of what being of being a man or being woman is different from your gonads. Right,
Gotcha.
because there are two separate, distinct processes, and this has also been shown in independent findings through neurological research. There are particular portions of the brain that are physically different among trans people. And it's like
Gotcha.
a majority, like a huge majority of trans people have that. I think it's like there's like a specific subcortical brain volume that is physically different. And I can provide that paper as well. That does exist.
Mm-hmm. Gotcha. Okay. Well, and just so you know, I don't have anything against trans people. Trans people should totally exist.
Yeah.
I know that there are a bunch of people that are probably religious that just think they shouldn't exist or they should stop trying.
Keep talking, by the way. I just have to, I'm going to grab some water. I can still hear you, however.
Okay, perfect.
So
yeah.
go ahead. Keep talking. Go ahead.
I will.
Sorry. I know it seems like rude or whatever, but I swear, I'm here. I'm here.
You're fine. You're fine. But yeah, so I don't have anything against trans people. I know plenty of them, family, friends, and whatnot. And so if somebody were born female and identified as male or man, whatever, I would use their pronouns for them. And I don't think there has to be a difference between the words sex and gender for somebody to be trans. Again, there might be a good reason from like.
I mean,
what
then
you explained.
then what would you call that incongruency, right? Like we're using the term gender to describe that incongruency between sex and an internal sense of bleh. Like, what is that?
Yeah, and maybe it needs to exist. Yeah, I don't know. Like, so if I saw a person like. Part of the thing is, and I guess we'll get into this on the next topic, which is the pronoun thing. But part of this is when we think of somebody as like whatever their sex or gender is, it's based on our perception. And then outside of that, people just know what theirs is. And then so somebody like every individual knows, you know yours, I know mine. And then trans people would know, okay, they're how they're going to present in life is not what they were born as. But then for everything else outside of an individual thinking about themselves, we're just perceiving people and thinking things. So there's tons of trans people that I would see and I just go, oh yeah, this woman's walking down the street about like Blair White or something, because like I would never think Blair White was not a woman if I just randomly saw her on the street without knowing.
That's just like what you're talking about there is you're kind of delving into the what people perceive your gender to be, and then the internal sense, right? Like a person may not pass at all, but their internal sense of their gender is there, right? And it may be incongruous to what people perceive externally. Does that make sense?
Yeah, I mean, it makes sense, and I believe it, but since I don't have an internal sense, I guess I wonder how many people do. Now, I have what me and you discussed, which is since I was born male, and I don't feel any weird thing about I don't have any urge within my mind to like change my sex or anything. Since I was born male, when I see other males, I might see in our society like... I keep trying to think of things that are thought of as negative in our society.
You're having no issue because you're your internal sense of your gender is congruent with your body. So there's
Hmm.
no issue there. But when I brought up the mastectomy and like if you started to grow breasts, all of a
Hmm.
sudden I bring out that you have an internal sense of being male.
Oh no, I don't think so because like
Then
let's
why would
say
you want to remove your beautiful breasts?
well, I'm going to tell you. Let's say at birth, I was put. They were going to do a study, and this wouldn't be a moral study, but they were going to. Let's say at birth, for some reason, they knew I was going to grow large, beautiful breasts, and they wanted to do a test to see if that would like match my internal thoughts or whatever. And so they put me in a like a Truman Show type situation. I'm just on some island with tribes of people or whatever, and on this island when people reach whatever age I would be growing these breasts, they just put breast implants inside of the males. And so I grow up witnessing every male having breasts and then I'm growing them. I don't think I would think for 1 second, I want these gone. Why would I want these gone? I would want these to be probably something like whatever's best perceived in that society
Yeah.
mixed with another element of me not caring. We have our own
Yeah.
individuality and then we,
You're delving
yeah.
into like the sociological aspect, which is the
Mhm.
part that I'm just not well
Well,
equipped to.
when
But
I, sure, which is fine. I'm just pointing out when I don't have a sense of
like I've read a
male.
little bit, but very
Yeah.
little. I
Does
mean,
that
like
make sense
I'm not
though?
equipped. Yeah,
Like,
no, I know exactly. I mean, you're
so I
delving into
would
like
not remove
what is
those.
like general, like what like you're talking about like communally, like how societies perceive gender. Like for whatever reason, drinking a cosmopolitan is seen as like a girly drink. I don't know
Mm-hmm.
what because it's sweet, but I got news for you. So are old fashions.
Gotcha.
Old fashions is a fruity drink. It is. It's fruity. It's
Yeah.
it's it's orange. Like
Gotcha. Yeah. Yeah.
anyway, but like I don't know for whatever reason, an old fashioned that's for guys, but the
Yeah. Hmm.
cosmopolitan that's for girls. I'm just like, okay, well that's weird, but all right. I think
Yeah.
that's what kind of what you're delving into
Yeah.
regarding like,
Well, I'm just
but
pointing out
women
that
they
that
get breasts
yeah.
because of that they have estrogen that allows
Yeah.
breasts to grow.
Yeah.
The
But
fat
does that make
placement is
sense?
different.
Like
I
I'm
don't know
not.
why I can't hear you. What happened?
Uh-oh. Hello. Testing. Testing.
I cannot
Testing.
hear you right now. I don't
Weird.
know what just happened.
I'm not muted on my end.
I will check on my end to see what's
Okay.
going on, but I unironically cannot hear you. Hold on.
Testing.
Oh, I
Testing.
just muted myself.
Oh, okay.
No, I'm an idiot. I'm an idiot. I muted myself. I don't know
You're
what's
good.
muted me.
You're good.
Anyway, sorry. Go ahead.
The main thing we don't need to get into the sociology of it. I just wanted to point out that I wouldn't be removing these because I have this internal feeling of whatever involving gender. I'm saying that I would remove that. Like honestly, I'm pretty sure, I'm almost positive that if I grew breasts and every male around me grew breasts, I would just thumbs up it.
Yeah.
I don't go along with every trend in society. I don't even drink alcohol. I'm not into football or cars or, whatever might be popular. But when there are certain things like for example, in the US, it's very common, for males to be circumcised, where in a lot of countries, it's not common at all. Like it's like zero people. And so I am not circumcised. And so
Mhm.
because the society I'm in, and when you hear about it talked about in movies and stuff, that type of thing would make me maybe feel a little more uncomfortable, or I would have this feeling if I was going to be presenting myself to somebody. Whereas if I moved to that other country where nobody was, then I wouldn't even think twice about it. So again, there's just elements of depending on how extreme thoughts are about certain topics in a
Mhm.
society. So anyways, if that makes sense. I don't know how many people are like that, like me, where there's no thought of gender. Like, how do you view, or I'll say sex to make it less complicated. Like, do you have a thought of what it's like to be a male?
Yeah.
Okay. What does that feel like?
Um, well, I like going to the gym. I want to look stronger. I
Yeah.
want to
Mhm.
look manly. I want to smoke cigars and drink whiskey. Uh, I, you know, let me also just say, like, most philosophers are male. I like philosophy. It's
Hmm.
interesting to me. I'm not that women can't be philosophers, but I'm
Hmm.
simply saying that there are some male typical traits.
No, it sounds to me like everything you're saying is how I'm discussing it. Now, I don't care about cigars or anything, but I like going to the gym. I want to be muscular. If
How
I
long
could
have you
like,
been going to the gym?
well, I say gym, but I actually just do a lot of calisthenic stuff, either at
Oh,
parks or at
nice.
my house, at the pull-up bar
I
and stuff like that.
It looks like I am tiny, but
Uh-huh.
I swear to you, I have an otter body. It's like it's the most sleeper build. I've been going to the gym for like 4 years, and I don't have much to show for it. But
Gotcha.
I do have muscles. I swear, it's
That's cool.
there.
But yeah, and same thing with philosophy. I love philosophy. I don't. I do. It seems to be that it's more often men are interested in philosophy than women, and I notice that. I don't think it matters necessarily. But anyways, these things that
They may have been
you're
excluded from society, and that's
Mhm.
why there's like a lack of interest in philosophy. Like I mean, have you ever read Mary Wollstonecraft's book on the vindication of the rights of women? Have you ever heard of
Mm-mm.
her?
No.
She was this feminist philosopher that was basically like arguing like a Lockean theorem of wanting to give women rights. Like it was just
Mm.
like, oh, we are bestowed with reason by God, and so we should be equal to that of men. It's just this wild book
Hmm.
that's it's very like John Locke style, and it's like really interesting to see like a feminist in like the 1700s, like
Yeah.
complete left field, like where it's like I cannot believe this person wasn't hung, like.
Yeah. Right. Yeah. That's wild. I'll have to I'll have to check her out. But yeah. What was I gonna say? Yeah. Anyway, so I guess I just I wonder how much of this thing that we're doing with wanting muscles and these different things are based more on the ideas I was discussing, where if you were on an island where you grew up where all the males had boobs and then you had boobs, would you think, oh, I wish these were gone because the men only have boobs because it's a study and all of them are actors? Like something in your mind maybe should tell you you don't want them, but I just don't think that's true. I would
Well, I
assume
think
not.
that women tend to grow boobs, men do not tend to grow boobs, and so
Mhm.
boobs will be seen as feminine just naturally. And it doesn't matter what culture you grow. I apologize. What culture that you grow up in, boobs are going to generally be seen as a feminine trait.
W- Even if everybody has them.
But everybody isn't going to have them.
Well, I meant in
That
the study. So, like, if you
like
were the only
chemically,
one.
it's not really like you're determined that boobs will be for
Oh, yeah. No, I'm referring
and
to a study. So you grow up and you're the only one that's not in on it. And all the women, all the men, everybody in the society that you're in, like a Truman Show type thing, they all have breasts, all the exact size. And
mhm.
yours grows to that exact size. I don't think you would personally view that as feminine. And I also
Sure,
don't think you would
sure.
want them
I
removed.
guess if in a vacuum, sure, but I just like I'm just simply saying that.
But I think a trans person in that society that had the mental state of thinking, I don't want to be this thing, because if I didn't have this nonsense non-space sense of sex, if I felt a sense of sex but had my own mind the way it is, I would just leave. It'd be fine. If tomorrow I woke up as a woman, let's just say I was Rachel Ziegler. I woke up tomorrow as Rachel Ziegler. I would just be like, okay, I'll live this life now. And then because I'm being perceived as a woman, I would probably do a mixture of 50%
All
of the
right,
things I naturally want to
hold
do.
on.
Okay. Yeah.
I, I'm going to ask you like a bit of a more personal question.
You typed her
Are
name fast. But anyways, go
Yeah, why is
on.
that presenting? I don't want that to present. I
Oh,
was just
sorry.
googling her.
Sorry, you had something on my screen that said to add to screens. It was from the
Okay, all
last
right,
thing
no,
you brought up.
no problem, no problem.
Okay.
All right. So yeah. I just looked her up. I was like,
Okay.
I don't know names very well. I know faces. I'm not very good with names. But okay, are you at all sexually active?
Yeah.
Okay. And so if you became Rachel Ziegler, you would like, would you just start having sex with men? Would you be okay with
Yeah.
that? Really?
Yeah. I think so. I mean, I don't know.
That's very different
I would
from
do
what
it.
most people
Oh, okay.
would yeah, they would be like, no, I would be
I mean, I'm just trying.
intensely bothered by that.
Yeah, I'm just trying to think honestly about it. And
Are you bi? You
no, no. I mean, I don't think so. I don't know. Have I pondered like different things? Like, would I be
I
up for
mean,
trying out a thing? I've never tried out a thing, and I doubt I would ever need to or whatever. I wouldn't classify myself as that. I only hesitate because, like, I don't know. I always hesitate on everything. But no, I'm married, and I've only ever dated women or females.
okay, so but then if you grow up a female, you'd just be perfectly okay with like being with a guy sexually.
Yeah. Sure. Well,
That's so strange.
I also might just become a lesbian. I don't know. If I had my exact mind, if tomorrow I woke up the exact brain, but just inside Rachel Ziegler's body, and therefore my body would react the way hers would. So since I have lady parts or whatever, things would still feel good. I would, I would just live my life as that person. Like I wouldn't think like if I cut my hair really short and remove these boobs and all these different things, I could get as close as I could to looking like a
Well,
male. I
just so
could
you
not
know,
imagine. And yeah,
that's why yeah, because most people would not have your thoughts on that. They would want to return to what they were
no way. Do
internally.
you think so?
Yes,
I
hundred
guess I
percent.
don't I don't ask enough people the question because I'm always looking for people to challenge my ideas. So
Yeah.
people that agree with me on like the list I sent you, I don't get enough of a chance to talk to them. I have just a handful of people in the chat, but anybody in the chat, go ahead and let me know what you would do if tomorrow you woke
Where are
up
you
in a
streaming, by
different
the way?
body. Mine's just streaming to the channel that I sent to you that I talked to you from before. It's called
Mhm.
Reasonable Vegan, and I have
Reasonable
two.
vegan, yeah.
Yeah, I have two different
And you're a
channels.
vegan?
One, yeah.
Okay.
But
I've
yeah,
had some vegan debates with other people.
gotcha. But yeah, there's just 5 people watching right now, and they're all
Okay,
chatting on
okay.
the side. They're fighting about trans stuff, but I figured I would see what they would do. How about you? And this doesn't affect trans stuff, so you should just answer honestly. Not that I would think you wouldn't, but it doesn't have to go along with how trans stuff works out. But if you woke up, we'll just stick with Rachel Ziegler. If you woke up with her body tomorrow,
Oh, me, I'm
would
bi. I wouldn't mind at all.
oh, so you think there's a
Honestly, that
connection
would
with
be kind of
somebody's sex
like,
and sexuality?
uh,
Or maybe you don't. I don't know. That just popped into my head.
I
That might
don't
have been a
know.
dumb
I
thought.
don't know. Good question. I don't know.
Um, because whether you are or not, like for example, if let's say I was severely unattracted to men, and therefore I woke up in a woman's body, I would just start dating women, and I would be a gay woman. I don't think what body you have or how you feel about it should be affected by who you're attracted to. Probably. Um, I like to think that gay people don't think like, oh, since I'm gay, I wish I was in a different body.
Yeah.
Anyways, stuff we can ponder at a different time. But do you want to?
I wanted to look at the next one that you have here. He says, I have not been convinced that anyone should feel morally obligated to use they, them, or neo pronouns. So when I hear neo pronouns, I'm hearing like the Z, zim, zir thing.
Yeah.
Yeah, I just haven't. I don't really have like a lot of academic research specifically
Yeah.
regarding like that. I know like that there's some like play and sociology regarding it. I don't
Mhm.
see like any of that like show up in any like biological or neurological. And I think that in order to make a proper case for trans people, I need to walk away from talking about the sociology because what a lot of people do is they're like, okay, it's just pretend. It's in your head. It's make believe. It's like schizophrenia, blah blah blah. And it's like, no, there's an actual. It exists in biological determinism, and so I just walk away entirely from the sociological aspect and go right into the biological nature behind it. And
Mm.
so when it comes to neopronouns, I have not seen a single person request
Hmm.
formally for like a neopronoun to be used outside of online spaces. I've just
Yeah.
not observed that at all.
Yeah.
Um,
Let me
and
respond to that real
honestly,
quick.
like if there's like a neopronoun, like I would find hardly a single soul that would be like, oh, I just they thems is like impossible. You
Mhm.
cannot possibly use they them. You have to. They get offended if you use a they them. Like it's just silly. Like
Mhm.
obviously they them is perfectly okay.
Okay. Well, how about this? If some, and I agree with you, this is mostly just a kind of a talking point for people online. And yeah, I've never had somebody ask me to use like a Zim or anything like that. But if somebody came up to me, and let's say that neopronouns didn't even exist yet, and somebody came up to me and they overheard me referring to them as he, him, and they said, "Hey, I decided I want my pronouns to be zim. So if you ever talk about me, even if I'm not here, I'd like you to use this zim thing." Would it be bad of me in this case, it being the first person ever and it being a neo pronoun, if I just say like, "Hey, I like maybe someday, but right now I just don't want to do that, but I won't do he, him either. I'll just not say anything." Let's assume they, them doesn't exist for a second, just for sake of this conversation. And then I just say, I'll just use your name. I'll just your name's Bob. I'll just say, yeah, Bob went over there, and yeah, Bob's gonna come here in a little bit, and I won't do Zim, and I won't do the one that bothers them. Would that be
Mhm.
bad of me?
Um, I don't think so. No. I mean, I don't think that you should feel morally obligated, but there's also like a sense of politeness that exists in just common
Mm-hmm.
parlance and everyday society. And you do this for all sorts of things, right? Like, generally, if you go, say, for example, oh, your friend is saying, hey, we're going to go to like a fancy restaurant and you're invited, I'm buying, right? You're probably going to dress better than what you normally would dress as. You know,
Mm-hmm.
you're going to abide by certain societal expectations of you. Like you're not going to like go there wearing boxers, for example. I mean, is it
Yeah.
legal that you go outside in boxers? Yeah, I mean, you're technically clothed, but also like, people will, you abide by a certain like what is appropriate versus inappropriate on a daily basis. And so when it comes to like using they thems or he she pronouns, like you want to use it's simply you being polite and is just another thing of like just operating in polite society. Like
Mm-hmm.
there doesn't need to be any legislation, there doesn't need to be any, it's just you being polite. And it's like you don't even have to believe in any of it. Like how many
Mm-hmm.
times, like, is it possible that, let's say for example, you have a person who's like not a doctor, like I don't know, a chiropractor or something. Sorry for if you're a actual doctor and a chiropractor.
No.
I don't like chiropractic. Okay, but let's say you're a chiropractor, right? And then you sit and like you're talking to them, and you're just talking to them normally, and they're like, "Well, actually, it's doctor." I didn't spend that much time in med. Like, I would probably just call them doctor, right? It would not bother me. It's not. It's no skin off my. Like, I wouldn't go out of my way to like be mean to the person.
Mm-hmm.
Like even if they're like, I don't know, a quack. Like if they're a quack, I still don't care. I just call them doctor just to get by through the day. Like,
Mm-hmm.
does that make sense?
Yeah, yeah, and I'm a nice person and I like to be nice. So like when people refuse to call Blair White she her, that throws me off. I get confused. If somebody asks my thoughts on it, like what I think they should do, I'd say just use she her. Like what does it matter? And but at the same time, if people have this like strong stance that they think it's bad, like in the same sense that they think encouraging trans stuff by using she her, they think it's similar to like anorexia or bulimia or whatever. I've heard that talked about, that they just don't feel like, they honestly, like their true feelings are that they don't want to encourage a thing that they think is like mentally unhelpful. I'd like to take people at their word. So for those people, even though I think they're going out of their way to do a different thing, I go like, okay, whatever. I'm not going to judge them harshly, but me, I will always do she, her, he, him for whoever wants it, unless I feel like they're messing with me. If somebody looked like me and they had a beard,
what was that
bald,
one person they like? I'm trying to remember their name. They're like on Fox News. They're like a millionaire because I just like how popular they are. But they would just like wear makeup and a dress. Like, do you know who I'm talking about?
Mm-mm.
Like, it was like this super conservative person that would just troll like people, like trans people, by wearing a dress and full makeup. And dude, this guy sat there and did this for months. He was like doing the gag and wearing the makeup, and he had like a different like outfit on like every day. Like, I'm just like, this dude is so committed to this. I'm just like, how is this person not actually trans?
Gotcha.
Okay,
Yeah.
okay. I wanted to move on though, because I see.
Okay.
I
Real
see
quick, somebody in chat is asking if you play RPGs, and if so, what gender ratio? I don't know what that means, but I'm guessing
like,
you might know.
I do play role-playing games. They're fun. Are you saying that like which like do I pick male or female when it tells you to select a character? I typically pick male, typically, sometimes female. Like, it doesn't, to me, it doesn't matter. It doesn't matter at all. It's just like, I'm just playing the game and it's fun. That's all.
Gotcha. Okay.
So I wanted to talk about where it says here, physical intervention on minors. So maybe, should I read this whole thing, or should I just like stick to one at a time?
So the first three are the same, but it's just puberty blockers and yeah.
Let me just read all four and then we'll see.
Okay.
This might be more of an issue with the okay, this is what you've typed. This might be more of an issue with the arbitrary line that we draw for adults, but I'm currently in favor of it being 18. One, I have not been convinced minors should be allowed any surgeries for trans reasons. Two, I haven't been convinced it's acceptable to offer puberty blockers for minors for trans reasons. Three, I have not been convinced that it is acceptable to offer HRT for minors for trans reasons. Quote, I am not too familiar with the effects of HRT on minors, so I might easily change my mind on this one. Four, I have not been convinced that minors should be made to share locker rooms with members of the opposite sex, although this highly depends on expectations and the amount of privacy offered. Okay, so I see that there's like a space here between the first three and the fourth one, because obviously the fourth one is very different from all the others. So what I like to, what I would recommend to take a look at is, and somebody else educated me on it, was the WPATH standards of care. Have you ever heard of it?
I've heard some people talking about it. Yeah.
So specifically what it is the World Professional Association for Transgender Health. It is something that has been around for a very long time. I will go ahead and share it right now so you can see it. Present. Share screen, I think. Share screen. Oh my God, this thing is so ridiculous. I hate this. All right. I think it's okay. So this is the standards of care. You can actually view the chapters of the SOC8, and the PDF is right here, where it will basically tell you exactly what is happening. I mean, you could just see the number of scientists that are actually involved in this particular, what they would consider to be like the standard of care regarding trans people and trans youth. I mean, we can go over specifically like what they argue under the basis of trans youth. But I mean, it goes through pretty much everything here.
Now,
Um,
I am curious. Before we do that, I want to ask you a couple questions, and then I kind of want to explain to you why my stance is what it is on the puberty blockers. But first, what would it take for you to be convinced that these guys got it wrong?
mm, there would have to be a great deal of information that would basically like just disprove the entire thing. There would have to be like an overwhelming majority. Um, uh, it would have to operate at a biological level, and it would have to show like a greater standard of care or like a greater outcome, specifically regarding individuals with gender dysphoria. Uh,
Okay.
and like, mind you, right? Most children, when they say that they are trans, it's a phase. Okay. And that's not a hot take to say. I don't think that should be a hot take. That should be pretty simple to understand. The You have to understand it. Oh, by the way, hold on. I don't know why. Are you serious? This thing can't share just like the PDF? Hold on. Give me. I hate this thing. I don't like it. I don't like it. I don't like StreamYard. We should do this on Discord.
Okay, I don't have a
Okay,
Discord, but I'll
that's
set
fine.
one up soon.
All right. So hold on. Where was I?
You were talking about it's a phase for most people, and that shouldn't be a hot
Yes.
take.
Yes. So like, I think it's like over 90%. Like usually what happens is that there's like an assessment to determine whether or not that they actually have gender dysphoria as an adolescent. And if they do have gender dysphoria, then and it's like particularly severe, they will assign hormone blockers, and then that gives usually it's usually assigned for about roughly 2 or 3 years, and then it basically allows for time to pass where they do not go through puberty. They can decide whether or not that this is actually what they want, right?
Mm-hmm.
And so what happens when you are taking a pre-puberty, the human body is basically like sexually the same thing. Like the males and females are the same, save for the genitals, right? Everything
Mm-hmm.
else is pretty much the same. Bone structure is the same, facial structure is the same. They're everything is pretty much the same. And so what they do is when you assign hormone blockers, it gives them time to figure out whether or not that they really feel like that they are not the correct gender. And then when they realize that they are not the correct gender for the next 2-3 years, then they will apply hormone replacement therapy, where they will use a suppressant of the chemical. Like for example, if they're male, they would be getting testosterone. They would use testosterone suppressants and then providing estrogen and progesterone in order to feminize that person. They will, they basically, their entire body, they go through effectively a female version in the sense of male to female. They go into a more feminized version. And what's good about this is that, and this is highlighted by the WPATH, where when they go through this type of treatment, it reduces the need of invasive surgeries. So the invasive surgeries such as mastectomies, there could also be fat displacements that change, very, very risky. It's the same thing with facial reconstruction surgeries. There are all of these things that are very typical for trans people, but they ultimately lead to it is basically a riskier procedure to not have that standard of care.
Gotcha.
Right?
Okay. Well, let me ask a couple things, and then we can get into the details of it. So I don't have a strong understanding of the effects of puberty blockers. I know for a while they were talked about as reversible, and here's kind of how I look at the potential. Here's how I look at how I don't think it can ever be fully reversible. Let's say somebody goes through puberty for the most part between 12 and 18. If somebody if we just took somebody and cloned them and had two different versions of them, one went through puberty from 12 to 18, the other one went on puberty blockers for 3 years during that time. It doesn't matter if they were 13, 14, whatever. It could even be at 12. I accept that if they went on puberty blockers when they were 12 until they were 15 and then went off them, puberty would resume in a sense. But at the end of that 18-year mark, if you look at both individuals, you have a clone, the final person is not going to be the same, correct? Even if puberty started resuming somewhat after the blockers were stopped, right?
So when you are taking hormone blockers, there's risks to just about any drug that you take, from aspirin to, and puberty blockers are no different. Of course, that means that one of the risks is a fertility loss. Another risk that is a potential is the bone density loss. These pubertal blockers, right? The first one regarding the fertility loss. Well, that is to me, right? That sounds like a discussion between the doctor, the patient, the parent, right? Because I believe that the parent should be able to consent on behalf of the child in this situation. With that being said, it is different among different youths. Does that make sense?
Yeah, I mean, just that each individual would react differently. Yeah.
So there can be different risks depending on different people between these two. The other one regarding the bone density loss is actually mitigated with a calcium supplement. That's all you need to do is they will tell you take a calcium supplement. So as soon as you get off puberty blockers, yes, that's exactly what happens. You go through puberty. As soon as you start going through puberty at an adolescent age and your body is turning into something that you do not want and is causing a great deal of gender dysphoria, then yes, typically hormone blockers are prescribed, and it is considered to be of relatively low risk. Right?
Gotcha.
And there is not, by the way, FYI, full consensus on this. I do at least want to point out that there are numerous European countries that say to not use hormone blockers and that they can just kind of grow out of it. That's true for a majority, that they grow out of it, but that's not true for everybody. And I also want to point out that there has been an increase of right-wing extremism across the several European countries, which has resulted in effectively changing or how the health tends to view trans people and the evidence of trans people. And so they've walked back a lot, not on the basis of like an actual scientific literature, but actually on the basis of an ideological one. And so I think that the science is there, and it's only a matter of time before we all get on the same page. And if we are seeing mixed research, like one saying, okay, it is effective, the other saying it is not effective, such as, and it is empirically backed, okay, then what that means is that it is likely a case-by-case basis, which just means you just talk to your doctor, and then if they're educated on this, which the W-Path suggests that you need to have special certifications to actually take on these types of patients, not just be a doctor, but you actually have to be trained in this. Then you can assign what is necessary and whatever is medically efficacious. I could show you.
Just so you know, there's somebody in chat that's asking to come on because they are extremely upset thinking that you are explaining something wrong. Should I bring them
Okay.
on or should I set up a
Sure. I mean,
separate talk with them later? Okay,
no, they could come on. Sure. I don't mind.
I'll give them a chance to come on, and then I'm just going to share the link in here, and then if somebody wants to hop on, they can. And then I have an interesting route I want to go discussing this. Well, I also want to check out what you had brought up, but let's see if they hop on here. I'll give them like 20 seconds. Let's see.
Here, can I present here? I'm going to try to present this. I hate this share screen thing. I don't like it, dude. I don't like it. All right. Do you see it?
Okay. Yep, I got it.
Okay. So puberty blockers for transgender and gender diverse youth. And this is by the Mayo Clinic. It is a strong standard regarding gender affirming care. Puberty blockers can be used to delay the changes of puberty in transgender and gender diverse youth who have started puberty. The medicines most often used for this purpose are called gonadotropin releasing hormone, or GnRH analogs. The summary of their possible benefits, side effects, and long-term effects. When taken regularly, GnRH analogs stop the body from making sex hormones. That includes testosterone as well as estrogen. Sex hormones affect the primary sex characteristics such as sexual organs present at birth, including the penis, the scrotum, testicles, the uterus, ovaries, and vagina. And the secondary sex characteristics are the physical changes of the body that appear during puberty. Examples would be breast development and growth of facial hair. In people assigned male at birth, GnRH analogs slow the growth of facial and body hair, prevent voice deepening, and limit the growth of the penis, scrotum, and testicles. If people assigned female at birth, this treatment limits or stops breast development and stops menstruation. What are the possible benefits? Gender identity in the internal sense of being male, female, or neither, or some combination of both. Gender dysphoria is a feeling of distress that can happen when a gender identity differs from a person's sex assigned at birth from sex-related physical characteristics. Some transgender and gender diverse people experience gender dysphoria, others do not. For transgender and gender diverse youth who have gender dysphoria, delaying puberty might improve their mental well-being, ease depression and anxiety, improve social interaction with others, lower the need of future surgeries, and ease thoughts of actions of self-harm. Taking puberty blockers alone, however, without other medical behavioral treatment might not be enough to ease gender dysphoria. What are the criteria for the use of puberty blockers? In most cases, to begin using puberty blocker, an individual needs to show a lasting pattern of gender nonconformity or gender dysphoria. They must have gender dysphoria that began or worsened at the start of puberty. To address any psychological, medical, or social problems that could interfere with treatment, and be able to understand the treatment and agree to have it. This is called informed consent. So, here's the thing, right? What I'm trying to point out is the position regarding hormone blockers and gender affirming care. It is actually already quite conservative in its position. Right. It is already like okay, this is the medicine. We can show that it does this. It's good. Okay.
Boy,
and then we go into best efficacy. Go ahead, Harmed. Sorry.
Hello.
Hello. Can you hear me? I'm trying
Yes.
to get my earpiece to work because my microphone's not so good.
Oh, I can hear you perfectly fine.
Can I give you? I'll give you a moment. I'm gonna make some soda water. I will be right back. I'm out.
Sounds good.
I can still hear you though. Just FYI.
All right, Carlson, can you hear me?
I can hear you.
My earpiece
Yes,
out.
I can hear you.
So much for that investment. Hello.
Yeah,
Hi.
we can both hear you. Yep.
Yeah. I think Googling things and then trying to pontificate is not how to discuss this. I'm sorry, you guys. When it comes to the application of gynotropic antagonists, or whatever the fuck they're called, I was supposed to insert the techno name for the GnRS inhibitors. The thing with this is they're used 3 times as long as on label because they're being used off label for the purpose of adjusting how someone who's very young in their puberty, by the way, is to present at the other end as soon as we're done with all the other adjustments as per their preference. Problem is, while we're hammering away, rehashing Harry Benjamin era binary thought, a majority of the people who are chemically disfigured by this fad are young females, simple as. Now, you got to pardon my ire and rancor here. I too was damaged by this this fad, and so maybe you might hear it in my voice. There's some hell to pay, and some outlier and or interloper comes Googling and trying to defend the status quo, which you are. You are the man, by the way, and must be brought to heel. And remaining ignorant of the Yogacarta principles, which is the central charter of the W path, as far back as 2011, not 2012, is often bantered about and online and junk. But before everyone was terminally online, your childless white women and a handful of trans billionaires rather backed this this usurpation of the application of Western science to remedy what was referred to as the transsexual phenomenon. Now, so for some reason, we're no longer calling it the transsexual phenomenon. And that's because trans is directly affiliated with the Yogacarta principles. Now, you like to Google a lot, Steve, so hop on that Google machine and look up Yogacarta principles, final fuckingly, and you'll notice that I'm actually talking about something.
Could you ease on the cursing, though? Like, that's usually not good for the...
Smug, like you were earlier during the chat. That's all I'm going to have to say. Okay? So I'm dealing with... I'm not only dealing with the personal damage, the unfuckability, the lack of a sex drive, all of that. So I'm differentiated from everyone else. But in the event that I feel harmed and I want to reach out to people and tell them about it, you're talking to a neutered individual without the balls and shit, and you can roll right the fuck over me. And I think it's just an outrage.
Can you stop cursing?
Nah. I'll try not to curse, but can you also...
Yeah, I mean, for the sake of the video.
The Google search so that you can finally find out that I know what I'm talking about and you don't need to be a insert curse word towards me, as you would probably hear on the streets. So let's keep it real. Just saying. Come on.
Okay, let's
Okay, I'm trying to understand, I guess. I'm trying to understand your
studies in the possession of progressive individuals is a cancer on society because they use it as a power grab. They used me as a power grab. I've harmed others, encouraging them to transition. I have to bring that to the grave. And you have to understand that it's not just being aggrieved, it's being involved in aggrieving others.
I'm not arguing what is
it doesn't matter what you're
force
arguing,
people to
remember?
transition.
You got to trust the sciencey science, even though Yogacarta principles is anti-Western science, and you refuse to look that up. So where are we at right now? Because you got to understand.
Well, I mean, I'm operating off of... All right, do we want to have a discussion? We can have a back and forth, and you can disagree with me. But if you don't allow me to speak, I mean, there is no discussion. We can't have a discussion.
We are having a discussion. It's just, you got to understand, coming out the gate, there's a lot of stuff where the left and progressives who try to co-opt the left, they hyper focus on a handful of things they're confident of winning at or whatever, and it excludes other input, and that's got to be heard before we go ahead and go back to...
So I should point out
the expectation that you're going to reel me in and then cause me to come along quietly to avoid being spontaneously disenfranchised, debanked, and then treated awful, and then you hand me a free needle when you finally give me that free tent somewhere in Oakland or whatever. You understand? We all know the routine, guy. We all know it. So, okay, now it's your turn. because that's how we
Okay,
feel.
so the the purpose of the W path is to promote evidence-based care, education, research, advocacy, public policy, and respect in transgender health. It has been something that has been founded in 1979, 45 years ago.
False.
That is not false.
False. You're
That is
reading
not false.
Wikipedia.
Yes, it's on Wikipedia. You can also
Yeah.
observe
Why would
this.
you
So-
use
So
Wikipedia?
the other issue is that if you can observe, they showed a revenue of 1,245,915 back in 2016, and the expenses was 1,144,284. What I'm trying to explain to you is that there's not
Is that you can
big,
Google it
giant
and find
money.
Wikipedia? Yeah, I know. So you can Google it and find it on Wikipedia.
Whether
What have you
whether or not
established
it's
here?
on Wikipedia is not even an argument. Actually, it's all it is just trying to poison the well.
No, I'm
all
not
I'm
poisoning
trying
the
to
well. I'm leading
Well,
up to a point.
that's what that
but,
is.
you know,
What I'm trying to point to you is that there's no big money and special interests that are thrown into this. There's really not a lot of money there. Okay, again, this is arguing under the basis of empirical research that has been carefully observed across multiple different fields of study. This is observed in the endocrinology. This is observed in the
which is
biology.
captured.
This is
Which is
observed.
captured.
This is observed in the neurochemistry. This is observed in the embryology.
No,
All of
it's
these
not.
fields. It is also observed in the psychology. All completely separate fields of science that they are able to observe dimorphic differences based off of genitalia alone. Now, I understand that you are saying that you are a victim of the system, and I'm not saying that there aren't victims of the system. I agree with you, okay, and I sympathize that that you had to go through that. That's a terrible scenario. What I would want is strong, rigorous care, so that way those who are legitimately transgender can get the care that they need, and that we do not create sweeping laws that remove people's autonomy to being able to live out a satisfying life.
So the sweeping laws are troublesome. We kind of agree on that because they can be used by the shit libs or the progressives as soon as they do as they often do.
I mean, I'm a liberal. I don't see why
I'm pretty sure
arguing
how
liberalism is a
one
bad.
defines a liberal has been usurpated, not unlike Harry Benjamin's standards of care have been usurpated by
Yeah, again,
liberal
the
arts
W path is
majors.
not a single person. The W path is hundreds and hundreds. It's 2,700 different doctors as of 2021 with only $1 million in revenue.
Yeah, how does that work, bro?
It's people that are interested in this research. They research and then they provide that research so that way they come up with evidence-based care.
Yeah. So in other words, citing the 990 form of a 501c3 doesn't really explain all of the youth centers opened up to create Darwin Awards and people who cannot reproduce and zipitits and
Trans people can
no nip
reproduce.
nut lops and a majority of our
Trans people can reproduce.
young women getting sucked into this fad.
Trans
so
people can reproduce.
Some can. And
Okay, so
they
the argument
produce
that they can't
troublesome
reproduce is kind of
results,
silly, isn't
however.
it?
What?
The argument that they cannot reproduce is kind of silly, isn't it? Right? Because you just contradicted yourself. That you were saying that they can't reproduce, and then I ask you, can they reproduce? You say, yes, some can reproduce. They can reproduce.
They can reproduce
Yeah.
troublesome results.
A trans woman can provide
So
sperm.
when we interrupt, we
and
don't
a
understand
trans
that
man can
the
get pregnant.
rhetorical device
That
that
exists.
you learned how to reflexively own the conservatives or whatever the crap is going on right there is not what
This
we're
is not
talking
an
about.
argument of like
What we
own the
are
conservatives.
talking
I'm arguing
about
under the
is
basis of
affirmative-only
evidence-based care.
application of
Okay,
trans
well,
medicine, which
on.
pushes a kid
I
to
gotta
continue to transition. You
Yeah.
cannot back out because it's politically untenable. That's
gotta
the part
pause.
that you don't seem to understand.
I
That's why
don't.
the
I'm not
numbers are
arguing
so
this on the
intense.
basis of politics. I'm
Nah,
arguing this on
dude,
the
it is
basis of
fucking
evidence-based
political. Don't you
care.
want
It's
to
not
know?
Okay.
political. It's a
Hey,
series of
Yeah, it is
psychologists,
political, darling.
psychiatrists, neurobiologists, all coming together
No,
to the
all of
same
that is where
conclusion.
that's nonsense.
I don't know what to
Reason
tell you.
being is because we're
That's
no
not
Okay.
longer
nonsense. I've
discussing
been
Western
providing paper
science. I
after
told you
paper. You've
already.
provided no studies. You've
Okay,
provided no
I,
information.
I'm gonna
I
pause you
don't
guys real
have to
quick.
provide you with studies, sir. I owe you nothing. Here's
Okay.
how we.
Okay.
This is
I'm
how
gonna-
we move forward.
Okay,
You
hold on.
look at Harry
I gotta
Benjamin.
hold on.
you
Okay,
look
I gotta
at-
mute you. I'm sorry. I gotta mute you. I don't know if you're muted on First Amender's end, but I had to mute you. I want to pause you guys real quick because I got to go here in a few minutes, and I wanted to ask First Amender a few more things. But I do want to re-ask a question for you to him that's similar to one that I had asked earlier. This person had stated that a handful of things you mentioned were organizations that were captured. Is there ever an organization that you think is captured, and what would it take you, First Amender, to think that an organization is captured? Or if somebody makes the claim, what would they need to show you to make you feel it was captured?
I would probably have to see, like, okay, well, where is the money flowing? Is it very clear that it is coming from some, like for example, like, is it a good example, like on the left, is it funded by the Young Turks, right? That would be an example of like, okay, that's obviously ideologically driven. And the same thing on the right, where it's like, okay, you have like, is this funded, for example, by the Heritage Foundation? That's where I would probably start raising red flags. But the W Path, again, is not any of those types of organizations. You're talking about a 501c3 that operates on the basis of evidence-based care. And certainly there are people that fall through the cracks, and it's sad that there are people where something like that can happen. That's why this evidence-based care is so necessary, right? We should not be pushing away from it, but rather in favor of it. So that way there's less and less people that get care that they actually need versus what they do not need.
Gotcha. Okay. So, guest, thank you for coming in. I'm going to have to give you the boot, but I want to tell you one thing real quick. I would love to set up a debate between you two that I moderate, and maybe it could be a 2v2 where we bring in some other people if you both want that. Also, if you just want to go talk with First Amender, his link is in the description of this live stream. And you can go there whenever he does his lives. I believe is on Thursdays. But I got to give you the boot now just because I only have a few minutes to ask some questions. But thanks for coming on.
Hang on a second. Can you hear me?
Yes.
All right. So Henry Benjamin's Standards of Care, version 6, did not have the Yoga Carta principles in the central charter. Henry Benjamin, Standards of Care, was not called WPATH. When the relabeling happens, it happens because Harry Benjamin was no longer alive, and the next generation took it over and politicized it. And you can see that if you just review version 6.
But it's not a single doctor. It's thousands
Holy
of
crap,
doctors.
I'm telling you that the central charter was introduced.
I have no idea who. I'm
This
just saying,
the
I don't know
charter.
who this Harry Benjamin person is. I'm operating
Why don't
under
you?
the basis of
You're-
the WPATH standards.
Well, then in
and it doesn't matter
1978,
what a single person is saying.
in 1978, it was Harry Benjamin. And you would know that if you knew about this, but you don't. And so I'm trying to explain to you that I shouldn't be kicked, and you should know that in 1978,
He's
not
just
the
telling you that he
WPATH.
has to go. That's all. Like,
Who
they're
is
not
he?
kicking you because Carson.
Okay, good. Well, then there's that. But so
Okay.
you
But
can look
yeah.
up Harry Benjamin, but instead you want to go ahead and play the game where you've owned me or whatever.
Yeah.
You don't need to study.
Owning.
You
This
just
is not
need
like
to
an
know.
owning. Why are you being so antagonistic?
I'm being
Okay.
antagonistic, so I'm remembered. That's how that works.
Okay,
Gotcha.
so this is
What you
literally
guys
just
did.
theater.
Well, no, it's not.
You
It's
literally
not
just
fair for me.
self-owned yourself because you were just saying how I was operating in bad faith, but you just admitted that you yourself are operating in bad faith just to get clicks.
No,
That's
I'm
wild.
operating
All
like
right.
a fucking.
Let's
I'm
talk.
acting like, bro. I'm using the same
Okay.
tactic that ACT UP uses.
Yeah.
they were they were very progressive. In fact,
Yeah.
beyond that.
It's not
And
sounding very effective.
Okay, well, I gotta
well, too
remove you
bad
from.
because
I got.
Harry Benjamin is actually.
Sorry, I muted you. I gotta remove you from the stream, but seriously, thanks for coming on. And if you guys do want to and can have a civil conversation, we'll set up a debate sometime. All right, take care. Okay, we're back. I got to hop off here in a few minutes, but I wanted to ask you a couple questions about the puberty blocker thing. So, if somebody that was not trans at all, that was just convinced, let's say for some reason, all their friends truly were trans and they wanted to go along with it or whatever, and they went on puberty blockers, but they weren't trans in any way. Does that idea, is that bothersome to you? Let's say they don't get convinced to do other things.
Yes, it is.
But they,
I have seen, there are certain pathways that people can take. Like I know, for example, there's like, I've heard, and I haven't been able to confirm it, Planned Parenthood, where they would just do one appointment and then hormone blockers. And it's just, I believe it takes more than just that. I think you do need to vet it. I think it does need to be carefully considered, so that way it is not, you do not end up with a negative outcome, right? Where it's like, it's just a fad. I operate under the basis of evidence-based research, the WPATH standards, not under the basis of some ideology.
Yeah, I gotcha. So what numbers would it take to, like, let's say out of every 100 people that went on puberty blockers, 5 of them were not trans and they were negatively affected by it, but the other 95 were trans and it had a benefit to it. In my mind, and I'd love to be tested on this. I could be wrong.
By the way, that would be highly successful, FYI. Like, there are negative outcomes for all sorts of different drugs that we hand. I mean, heck, we give our kids Ritalin. Like, and sometimes Ritalin works great, in others not so great, right? Again, it's just an operation of the doctor doing their job and analyzing their patient and see if it's actually doing the effect you want.
Yeah. Well, so here's the thing. I feel bad if anybody has a bad life. I don't like that. But if somebody has a bad life based on, I'll just throw out the word nature for fun. I feel different about that than if somebody was made to have a bad life. So I would rather, I think, and I could be wrong, it's just off the top of my head, if 95 were successful and benefited from it, but 5 had a downside, I think I would rather it not happen. Same thing with like prisons.
So would you, let me ask you this, would you ban cars?
No.
Well, I mean, if you think about it, right, what is the probability of getting into a car crash and getting injured or killed?
Yeah.
It's actually a stunningly high probability, but we still drive around in cars.
Yeah, but so everybody deciding to drive a car now kids are forced to be in cars, so that is a bummer, and maybe that element can be factored in. But as far as the drivers of the cars, they're all old enough to decide, okay, I'm aware car crashes exist. I can decide to do this thing.
You could be as young as 16 and start driving a car.
True, which is another interesting element because of and so it does make it complicated. But another example, real quick, like I would rather 100 guilty, horrible people go free and not go to jail than to have them all go to jail and one innocent person be executed. Like I think there's just a huge difference between like I don't view everything just based on the overall outcome. I think there's a huge difference. Like if somebody is born a certain way and as they grow up because of how they were born, they have a sad life, that sucks. And I wish we could fix that. But if fixing that meant harming someone else, it's kind of like the doctor taking a healthy patient to take 5 of their body parts, like their organs out to save 5 people. I don't think that's morally acceptable. And this isn't like that. It's not fully analogous because that's obviously directly killing somebody to save 5. But it feels something like that where I think the risk, it wouldn't, to me, and I'm curious to see with you, would even 50-50 be fine? If 10 people came in to go on puberty blockers?
If you're talking 50-50, that would just be, you really, like, whatever we're doing to vet is not working, right? And that
For
needs
sure.
to be changed.
But just
the actual
hypothetically.
medication can actually be is quite effective in specific scenarios. So like if you're seeing that much of a problem, then yeah, the vetting needs to
Yeah.
change, not necessarily access to the medication.
But even if the vetting should change, but let's say for some reason it doesn't, if 100 people came in and you knew that 60 of them were going to have better lives because of going on puberty blockers, but 40 of them were actually not trans and not going to have good lives, would you view that as worth doing, even though the vetting should be better? If it wasn't and that were to happen and you could click the button, would you rather that?
That's a risk that I believe needs to be a discussion between the patient and the doctor, right? Because then they can come to an informed decision. And by the way, the WPATH standards require, in order to receive hormone blockers, a fully informed decision from the parent as well as the child. Everybody has to be on board regarding this. And if there is any hint of it not being a well-informed decision on the relative risks, then it is not recommended.
Okay.
Right. That's the WPATH standard.
Okay. Well, let's say hypothetically, we recognize, because of how our society is, that maybe girls in...
I apologize. I'm shaking because my cat is smushing her face into my camera. I apologize.
You're fine. Let's say that teenage girls wanted bigger boobs and they wanted to get breast implants, and we started letting that happen at 13. And let's say there wouldn't be...
do.
Oh, do we? At 13? For real?
I don't know about 13, but we already allow minors to have breast implants. Yeah.
What? Okay. Well, let's say it doesn't happen at 13. And whether it does or not, I'm curious to hear if you think it should, even if the outcome, if emotionally they just feel like they would have better teenage lives with all the people being attracted to their boobs in school. If we knew that the outcome was going to be nice.
I could be wrong here.
Okay.
Hold on. Let me just...
But whether wrong or not,
confirm.
what would you want? Would you be fine with it? And I'm not saying it's necessarily the same thing. I'm just curious. And we can link it to other things.
Yes. So it says, in the United States, minors under the age of 18 cannot obtain plastic surgery without parental consent. So they can get breast augmentation as a minor. Yes.
Yeah, with parent consent. Yeah, and I think it's similar with like tattoos.
But again,
and stuff.
like this is a discussion of risk, and we already apply medicines under the basis of how much risk it's going to be. Again, that's a discussion between the doctor and the patient and the parent in the case if it's a child, and so that's not different for any other medication, right? We apply medications all the time and procedures all the time that carry a certain level of risk, right? Root canals can be risky. So can wisdom teeth removal. I don't think kids are getting wisdom teeth, but you get my point.
Yeah. And so I think there is a question to be had here of, is it good or not? What are the extremes? What things might we look back at and go, oh, we made a huge mistake here and that kind of thing. So that's why I want to...
Well, the current evidentiary standards it is effective. We can see that this leads to better outcomes. And then obviously, if there's something that is more efficacious, I'm all for it, right? I'm not married to like, oh, you must do this. No, I want what is best for the patient and people to live a better life. That's what my argument is.
Gotcha. If it turned out, like, let's say 10 years from now, it's discovered that it was a huge mistake, puberty blockers should stop being used at all outside of precocious puberty, would you be extremely shocked because you feel convinced enough now?
Because of how much research there is, it is not going in that direction. So I would be shocked by something like that. That would be but if there was evidence in that direction, then fine, fair enough. I go in the direction of the evidence. And what I have found overwhelmingly is that the people that argue against this have done no reading on this topic whatsoever, and they just they're following TikTok and they're following Twitter and they're listening to right-wing YouTubers, and that's their knowledge. They haven't read a single book on this topic.
Yeah.
Right. And it is overwhelming. It's overwhelmingly a lack of education on this subject and a lack of communication, maybe even on behalf of the science community, in failing to engage people, laymen, in this discussion.
Yeah, and I think you're probably right. I mean, I know myself. I've read some abstracts of some studies. I read a little bit of some meta-analysis on things within this topic, but I have not read much at all. I when I discuss this, I mostly discuss it as, if this were the case, then how would I feel here, and here? And my biggest concern is permanent things when it comes to children. And I don't know, again, like when it comes to the idea of letting 16-year-olds drive, or with a parent's permission, 16-year-olds can get like tattoos and stuff like that. I just, I think it's a complicated mess. And I think probably the way to know if you're talking to somebody that's genuine about it is how they view adults. If they say, okay, adults, do anything trans you want, kids, there's a concern, then you know at least whether they're right or wrong. They're being genuine about it. And I just think it's something I want to look into more. I think it would be interesting to discuss like what development happens to make it to where a 16-year-old can decide things like tattoos or a double mastectomy, or things like that. But anyways, I do got to hop off here. But I really enjoyed this talk.
We couldn't get through your whole list, but not bad. Yeah, I did enjoy the talk.
Yeah, awesome. Yeah, let's set up another one. And I'm setting up some debates on a separate channel soon, if that ends up being something you're interested in. But yeah,
sure,
anyways.
If you want to have me on, I mean, I'm anybody that wants to debate me, I'm an open book. Come on it, and we'll have the debate.
Awesome. Sounds good. Okay, well, thanks for talking, and you have a good one.
Yep, thank you.
All right, take care.